Hello everyone, myself Dr. Neetu Modgil. I am ENT consultant working with Care Hospitals, Hyderabad. Today we will talk about tinnitus. Tinnitus is a sound which is produced inside the ear, one ear or both the ears. It is a type of sound which you can hear from a cricket, which is an insect present in villages or in the jungles. It makes a sound like quee sound, continuous sound. It is a disturbance or a noise which is perceived by the patient in one or both the ears. Sometimes patients do not have this particular type of sound. They may present with the heartbeat they feel inside the sound, inside the ear. It is again a type of tinnitus. There is another variant of tinnitus in which patients, they feel pain in the ear with the loud sound. Even with the normal sound, which is normal for rest of the population, they feel that particular sound being painful to the ear. So the pain in the ear with the sounds, high volume sound or normal volume sounds, heartbeat sounds, squeak sound, fish, fish, sometimes like this also, sometimes a sound of a generator type of thing. All these are the variants of the tinnitus. So tinnitus is the sound which only a patient can perceive. It is called subjective tinnitus. There is one called objective tinnitus in which they do have some click sound of this joint, which examiner can also hear while coming closer to the patient, and maybe some blood vessel which is having engorged blood vessels inside the ear. They produce the sound in which a patient or examiner can feel by putting a stethoscope here. This is called objective tinnitus, which is very rare. Only 5% patients present with objective tinnitus. 95% patients are having subjective tinnitus. Now, tinnitus has become a big problem, especially during the corona period, because many of the people are working from home and they are using headphones and they are working with the earplugs, and meeting times definitely is the same. So they have to do all the meetings by headphones and the earphones, and it has led to more exposure to the volume decibels by the headphones. And then many patients are presenting with tinnitus nowadays. So it tells that tinnitus usually happens because of the ear problem. So mostly patients who are having tinnitus, they usually have some cause in the ear, but there can be central causes also. There can be cardiovascular causes also. There can be muscular causes also. Muscular means twitching of the muscles or some joint problem. So tinnitus is a symptom. It's just like fever is a symptom, many causes, malaria, typhoid, dengue. Same way tinnitus is a symptom, there are many causes behind it. So you have to be impatiently patient about tinnitus. I will explain you what I mean to say by impatiently patient. You should be impatient to come to the doctor. You should immediately take it as an emergency, come to the doctor, because earlier we find the cause behind the tinnitus, it is easier for us to treat the patient. That is being impatient. You have to be patient about the treatment. Sometimes the problems which are leading to the tinnitus, they take time to heal. Even if we heal or we solve the problem, tinnitus persists for some time even after treating the patient. So you have to be patient about the treatment. So just be impatient, come to the doctor immediately, and be patient about the treatment. Don't run with one doctor, second doctor, third doctor about it. You just have to be with the ENT first for the tinnitus. If ENT doctor has evaluated you completely and he or she is not finding any reason behind the tinnitus from the ear, then the doctor can refer you to the further doctor, cardiovascular or the neurology doctor. And this is how we deal with the tinnitus. Thank you so much.